Well, good afternoon. Today, what we have is a lot of sad news. So we are reporting now that 326 Detroiters have died of COVID-19. We're reporting 54 more cases today than yesterday. And it is a reminder to all of us that this fight is not over. I heard people complaining about the governor extending her order and that she was doing too much. And this is a reminder as to why we have to do this. We are making progress. You've heard statements from the hospitals that the rate of admissions is slowing, and that's true. But what has happened is we've gone from going up at this rate to bending the curve and going up at this rate, but we're still going up. And we have to continue to be vigilant. So 54 families in this city are grieving today, and we all grieve with them. I'll continue to talk to you about the data because I know there's people out here who are following it closely, and I don't know any other way to be except completely candid with you on it. Of the 54 that we're reporting today, only 39 died yesterday. We have weeks of delays, particularly with tests that don't come in on people who may have passed a week or 10 days ago. So the others were back as far as March 26th. But even at 39 that died yesterday, it is the highest number that we have seen. And we're likely to see more days of this. And we're going to see it for this reason. It was about 2 weeks ago that we saw the huge surge into the hospitals. And while a lot of patients are being discharged from the hospitals today, you've also got a lot of patients who have been on ventilators for a week or two. They are our most vulnerable citizens. This is going to be a period of time where those who are fighting for their lives on the ventilators, our hospitals are having a lot of success with many patients, but in a number of cases, we're not succeeding. And probably the most aggravating thing of all to me is that 7 of the deaths we're reporting today were at nursing homes. I mean, our most vulnerable citizens are dying in a helpless manner. The last couple of days, Denise Fair and her health team have been out there. We started at 2 of the nursing homes with the biggest infection problems, but the rates of infection that we are seeing are really disturbing. And we'll have data for you on that by Monday. But I have no idea where we would be without the Abbott 15-minute tests. Because if you think about the situations that the nursing homes and the homeless shelters have been in, by and large in this country, it takes 4 to 5 days to get a lab result back if you're lucky, 8 to 9 days if you're more common. So think about it. If you go through your nursing home and test people, if you don't get results back for 4 or 5 days, well, 4 or 5 days later, you may have a whole different set of people who are contagious. And as we now know, people who are showing no symptoms at all are infecting other people. There's really no effective way to deal with this except go in at once, get a quick test result, and separate people. If the 15-minute tests had been available in this country a month before, I think we would have had a very different situation, and that's a heartbreak that our health providers are living with. But our teams are all the way out there now in the nursing homes and the homeless shelters. We will test 1,200 people in the next 7 or 8 days in nursing homes and homeless shelters. And we will get those tests turned around in the Abbott 15-minute test. We will get them back to the nursing homes and the homeless shelters. We will get people isolated appropriately. Prompt testing is the center of any strategy to fight an epidemic, and it's a tool that we haven't had until too late. But I'm afraid we're going to see more days like this. And so the cooperation we've seen from the city is enormous. We've gone from our death rate doubling every 3 or 4 days to our death rate doubling every 7 or 8 days. But there's nothing to celebrate about the fact that our neighbors are dying every 7 or 8 days. We have to stay with this so diligently until we completely break the back of this virus. There is one thing that folks can do if they could help us. We have plenty of Abbott 15-minute tests, which are the scarcity in America. We really could use a couple of Abbott ID Now machines. And they are in a lot of doctors' offices. They're the machines you use to do the instant strep throat or flu tests. If any physician's office or anybody else out there has an Abbott ID Now machine that we could use for 3 or 4 weeks, it will allow us to get through these nursing homes. We are running our 5 machines now 18, 20 hours a day, and I'm very concerned about how long they will last working those hours. If we had a couple of other machines, it would help enormously. So I'm hoping that there's some office manager, some physician practice out there who can spare that machine for the next few weeks. As I say, we've got the test kits, and when the kits become available, everybody will send your machine back. But I know Denise Fair and her team would benefit enormously if we had a couple of more machines. We talked to you a little bit about developments at the Detroit Water and Sewer Department. Gary Brown has had to shut down the Central Services facility on Huber. 12 DWSD employees have tested positive for COVID-19. This is the place where we've been running about 2/3 of the water restorations in this city. Fortunately, we're completely caught up in those restorations, and the other office that's running 1/3 is promptly handling anybody who calls in. Everybody who called in before has been addressed. If we get any new calls, the other office can handle it, but the folks who are out there turning on the water are now some of our folks who are positive for COVID-19. Every one of the 65 DWSD employees at that site will be tested in the next couple days. The site will be deep cleaned, and it'll be back open on Wednesday. But it's a reminder to us that it's not just police, fire, and EMTs that are at risk serving the public. And again, our health department is supporting our employees at DWSD. Talked to Chief Craig, who is just waiting for a doctor's clearance to be back at the office, and Assistant Chief White. And I had all the precinct commanders on for an hour today asking what they wanted from me for Easter weekend to make sure that we don't stop the progress that we're making on bending this curve. To a person, every one of the commanders is expressing enormous appreciation for the cooperation of the city. You drive around the city now, folks are out with masks. In the parks, they're spreading out. People are being so respectful. And DPD asked if we could supply the officers with surgical masks for the public, much like we're doing on the buses. And so today we did that. And so we have put masks in every patrol car in this city. And if an officer sees you on the street, they may stop you and ask in a very positive way, would you like a mask? It's not threatening, you don't have to take it, and I see a lot of people have followed Denise Fair's instructions and made their own masks, but our police cars will have surgical masks available for the public if you don't have one, and when they're stopping, there's nothing to worry about. They're just wanting to be helpful. The one area that has been disappointing, even though 99% of this city has been terrific, has been the skate park at Riverside Park in southwest Detroit. And the police are continuing to have to make runs over and over to people who are ignoring us. And so I have shut down the skate park at Riverside Park. We're shutting down the parking area. I am not going to have police cars having to make the same runs over and over to the same people who refuse to comply. So the Riverside Park skate park is shut down, but the precinct commanders across the city said, don't shut down any of the other parks. Our citizens are cooperating. They're being positive. There is one other request that they would make. They are seeing more and more groups of 10, 11, 12-year-olds out in large groups. And I think the most effective way to deal with groups of 10, 11, and 12-year-olds is not the police. We're asking the parents and the caregivers, please ask your young people to stay home. Please keep track of them. The police shouldn't be dealing with them. This is something parents should handle, and particularly coming up on Easter weekend. I'm really asking the parents, the grandparents, the caregivers in this city to avoid this. I know that 10, 11, and 12-year-olds are not being seriously affected by this disease themselves, but they are spreading it in this community, and we need to keep them as separated as we do the adults. So with regard to the same day or the drive-through testing, we have gone up now to 800 tests a day. I wanted to go to 1,000 tests a day, and we needed the staff to do it. And I know Governor Whitmer is working on even more lab capacity, which could potentially allow us to go a lot higher than that. But to get up to 1,000, first we have to deal with the call center. If you've been calling the call center, you know that you could wait on hold a long time. And I've talked to the folks at Quicken, and when Quicken, who has run this call center, they've never asked for $1. When they started it, their telephone operators had time on their hands because nobody was calling for mortgages. Now, Quicken is very much engaged in working out payment extensions for people who are behind in their mortgages. And so they're on the phone all day with their customers working out relief, and it put a demand on them. But to their credit, Quicken has now hired 8 more staff starting Monday. And so if you have been having trouble getting through or you've been having a long wait time on your calls for appointments, Quicken is doing everything you could possibly ask them to do, and I think it will get easier. But we also needed more medical staff. And the person who really pioneered the drive-through testing in this city was Dr. Phil Levy in Wayne State University. Back on March 20th, over in Midtown, he just opened up a site and started. And he wasn't sure how he was going to do it. The day he opened, I was over there studying it. Our team has been over there studying it. And it was remarkable what he did for the healthcare workers, for the first responders. He was offering testing on a drive-through basis before anybody was. And now that we have one of the best operating drive-through testing sites in the country at the State Fairgrounds, I'm really pleased about the fact that Dr. Levy in Wayne State came and said, how about we join forces? You want to do 1,000 a day plus at the fairgrounds. If we came in and joined with you, you could do 1,000 and we could probably go above that. And so I am just so proud of everything he's done, and I'm proud of the fact now that our great partners at Henry Ford, DMC, and Trinity that have been carrying the load at that fairgrounds testing site are now being joined by a partner who brings great resources. And so let me introduce the man who started all this, Dr. Phil Levy.
Thank you very much, Mayor Duggan. We are truly pleased to be able to work together with the city to join forces on the drive-through testing that we have ongoing. As you mentioned, we started on March 20th. To date, we've tested over 3,300 first responders and healthcare workers, and the time is right to join forces. We want to be able to ramp up the number of tests that we can offer across the city, and the system that you have set up at the fairgrounds, it's really efficient and effective, and it's going to make a lot of sense for us to pull together.
So Wayne State and the city joined forces with the hospital systems, and let the governor make her own announcements, but with the governor's contribution later today, you're going to be able to see us enlarge past 1,000 a day. We're going to keep going until every single Detroiter gets tested. The last thing I want to talk to you about is something we've been working on for a while, and that is how do we deal with the question of hazard pay for our first responders. We've had more than 200 city employees tested positive for COVID-19 on the front lines: police, fire, EMT, DDOT, B-seat inspectors. We've lost 3 members of the police department, 1 member of the fire department, 1 bus driver, and 2 inspectors at the building safety and engineering department. And through all of that, our workers keep coming to work. We have had full police crews, full fire crews, full DDOT pullout every single day, even as these public employees were grieving over their coworkers. They showed up for work. And so I was hoping that Congress would deal with this. Senator Gary Peters took the lead in sponsoring legislation for federal funding for first responders. In the Trump administration, Secretary Mnuchin came out and said he supported it. I thought for one brief moment when the President and the Senate Democrats agreed that it was going to get done and the first responders were going to be compensated, but now it's clear Washington doesn't work that way and it's bogged down, and I'm feeling a need for us to act. We acted immediately, and I think ahead of most cities, by saying that any employee who is off with COVID-19 or who has been quarantined gets full pay, that we aren't making people take their sick or vacation time. We are paying those who are sick. We are paying those who are quarantined. I did that by order day 1, and that I felt was the immediate first step. Now the question becomes, what do you do to our public employees who show up for work every day who aren't sick? Don't they deserve to be treated in a way that recognizes this? And not once has any employee in our department said to us, if you don't pay me more, I won't come to work. They've just shown up and done the job because that's who they are. But I think it needs to be recognized. And when Atlanta went to a $500 a month hazard pay, I've been looking at wanting to do something along those lines. And we are going to start on Monday. We can't legally pay people retroactively for work that's already been done. And so instead of $500 a month starting Monday, I want to pay our first responders and our public-facing employees the equivalent of $800 a month in additional pay for COVID-19. And the way that we're going to do this is for the great majority of employees, we're going to pay you an extra $5 an hour for the hours you work. So if you work a 40-hour week, it's $200 a week, about $800 a month. For our firefighters who work 9 shifts a month, we'll pay you $90 a shift extra. Again, it will come out to about $800 a month. But we are going to pay our first responders and our public-facing employees in other departments. So this is going to start on Monday. It'll apply to people in 6 city departments: police, fire, EMS, DDOT, the General Services Department, the Water Department, the Health Department, and the Building Safety and Engineering Department. We'll have details up on the website. I'm going to issue the emergency order on Monday, but basically in the Detroit Police Department, it will apply to commanders on down. It's going to be the people who are out interacting with the public. We're not paying the folks who are sitting in the office. It will also apply to our dispatchers and our call takers who, as far as I'm concerned, are first responders as well. And we lost a 911 call taker, as you know, early on in this process. In the Detroit Fire Department, it's going to apply to battalion chiefs on down. At EMS, it's going to apply to captains on down. Again, the folks who are out in the field. In the Water Department, it'll apply to the field technicians and some related jobs. In the General Services Department, it's going to apply to the folks who are distributing the food at our rec centers to our children. It'll apply to the workers who are out working at the fairgrounds and a number of other categories that will be posted in the health department. Denise Fair's crew that's out testing our nursing homes right now and a number of other public-facing groups. And in the building safety engineering department, our inspectors. At DDOT, it will apply to our bus drivers, and it will also apply to the cleaning and maintenance crews who are removing the COVID-19 germs continuously from our bus service and protecting the public. So what we will be doing is posting on the website a list. It's 6 different departments, probably 14 different unions. Take a look at it. If you're a public-facing employee, meaning you are on the job and interacting with the public on a daily basis, and we've missed your classification, your union leader should let Denise Fair know over the weekend, so when we issue the order on Monday, that we can make sure to take care of you. And so I intend to leave this order in place as long as the emergency is here. And the way I'm thinking about it is until the governor significantly eases Emergency Order 20-42, her current shelter-in-place order. So I would expect it to stay in place until that happens. And so I wish we could do more because our men and women deserve it. But next week, I'm going to have to be rolling out $100 million in budget cuts. I mean, that's the truth. We have a legal obligation to balance the budget. I am never going to have the Financial Review Commission take control of this city's finances again. And so we're going to have to make hard choices for those cuts. And so I had to balance what I thought was the very deserving needs of our first responders and our public-facing employees against the pain that all 9,000 employees will feel when we have to bring this budget in line. And I hope when you look at this, most people will feel that we've dealt with this fairly. I am continuing to lobby Congress on behalf of the Gary Peters proposal. I've talked to most members of our congressional delegation already, and my hope is that there will be more pay coming from federal appropriation for our first responders and public-facing employees. But starting Monday, it'll be the equivalent of an extra $800 a month. And with that, I'll turn it over to our Health Director, Denise Fair.
Thank you, Mayor, and thank you for your continued leadership. So on yesterday, Congresswoman Brenda Lawrence's sincerity, as well as the efforts of Governor Whitmer addressing how this horrific virus is disproportionately impacting African Americans, people who look just like me, only reinforces my resolve. I will continue being transparent and giving Detroiters the facts so they have the right information to protect themselves and their family. This is my commitment. Since we began these press conferences, I have encouraged Detroiters to wash their hands, disinfect surfaces, cough or sneeze in a tissue or a sleeve, and remain at home, especially when going to the grocery store or to the pharmacy. This messaging is being reinforced across various channels, including daily educational webinars and teleconferences, multiple social media posts, email, print, TV, and radio ads. Now, on the surface, these precautions may appear to be simple. Some of you have initially thought this could not affect me, but I'm here to say that these simple messages and these steps should be taken seriously for your own safety. I believe in my heart that Detroiters are listening. I see you wearing a mask, owning it, knowing that this is your responsibility, and I thank you for keeping Detroiters safe. Today, we now have 6,228 confirmed cases here in Detroit and 326 confirmed deaths, and my heart goes out to the families of those devastating losses. With the strategies that we put in place by the Detroit Health Department in partnership with nursing facilities, homeless shelters, grocery stores, and the like, we can flatten the curve, especially if we continue to follow these guidelines that I share every day. This is Detroit, the place that put the world on wheels and gave it a reason to sing. So let's continue to take care of home and our neighbors, reach out to each other, check in via phone, FaceTime, and a quick text. When we do this, we will be able to experience many more Detroit first together. Please continue to be safe. And with that, I'll turn it over to you.
One last note before I take questions. Again, if you look at the number of confirmed cases in Detroit, they went up a relatively small amount. For the second day in a row, that is a function of lab processing. What we have learned about going from 2-millimeter vials to 3-millimeter vials is more than we wanted to know, but it's been solved by our reference labs in New Jersey. It's just a phenomenal partner, and the machines are now moving full speed. But again, I would say to you, don't take the low rate of infections today as evidence of a slowing. It is an evidence of a processing glitch at the lab that has now been corrected. You will see those numbers grow in the next couple days. We are bending the curve, but make no mistake, the infection rate and the deaths are still rising in this city. We have more work to do. If we keep doing what we're doing, we will get there, but this isn't over. And with that, I'll take any questions.
Good afternoon, Mr. Mayor and company. Jim Kurtzner with Channel 7. This is Good Friday. Easter is on Sunday. Greek Easter is a week from Sunday. Have you had conversations with the pastors in town about holding services, about outdoor services, about social distancing? And it's our understanding, and Mayor, what is your understanding, that churches are exempt from the governor's executive order?
So this is an issue between the ministers and the governor, and I know they've had direct conversations, but for the ministers I've talked to, they intend to either do it online or they intend to space out, but the governor has taken the position that her order does not override the First Amendment right to freedom of religion. So that's an issue that you should direct to the governor, but my understanding is that the ministers and the governor have been having those conversations.
You have said here day after day after day, social distancing, wear masks, and live safely. If a church does gather, doesn't that fly in the face of all of those messages?
So I do not believe that people should be gathered for any purpose without significant spacing and without masks. I don't walk anywhere without a mask, and this is probably the thing I'm angriest about, and it's nobody's fault. But when we started, the CDC told us, don't wear masks. If you're not symptomatic, you're not contagious. This disease spread through this country with asymptomatic people. Some people never knew they had it. Their symptoms were so mild. And so if 5 or 6 people are gathered near each other, mathematically, there's an excellent chance one of them has it. And so, again, this is an issue relative to the governor and the enforcement of the order, but I would say this to anybody. People should not be within 6 feet of each other. They should be wearing masks. And I know how much the ministers in this town care for their congregation, and I trust them to do the right thing.
Mr. Mayor, Ken Coleman, MichiganAdvance.com. You said in previous days that the confirmed cases, at the State Fair site is about 43%. How are we running in terms of total number of people tested at that site and the percentage?
It's still, as of yesterday, 43%. I think we've tested 7,000, and today we're probably testing 800.
Okay.
But it has not. We had a dip down one day to about 41%, and it came up the next day. But it has not materially moved. But I look at those numbers every single day. Again, but if you look at our 15-minute testing, it's closer to 20%. And it's really a question of who you're testing. The people coming through the fairgrounds have symptoms, right? You got to have symptoms to get a prescription and come out there. So it means the doctors are doing a good job at writing prescriptions. When we have gone, for example, through a police station and brought in everybody, regardless of symptoms, the numbers are running closer to 15 or 20%. And that's exactly what you would expect. And my guess is, and there's scientists who can tell you this better than I can, but I would be willing to bet 1 out of 5 or 1 out of 6 people in southeastern Michigan has this virus.
2 quick follow-ups related. And so that the people who are coming to the fairground site with a script, they could be Detroiters, they could be
Right.
They could be anybody.
Right.
Right. So they're not just Detroiters.
Right.
Okay. And then secondly,
Yeah, so Detroiters are running about 45%, and suburbanites are running about 42%. It's within a couple of points. I mean, this is everywhere in southeastern Michigan.
And then finally, you've talked, and the assistant police chief has talked about congregating at parks and on basketball courts. I've done some reporting for Advance, and I've seen some courts, some basketball rims that I knew, and I know that were up 4 or 5 days ago, and they're down.
Right.
Can you confirm whether or not city employees are taking those
Oh,
down?
yeah.
Okay.
Oh,
Just
yeah.
wanted to be clear.
No, there's no question how it's working. So the police command staff, Brad Dick runs our general services department. The police command staff does there. By now, when we do the conference calls, Brad is on the conference calls. And so the command staff gives the general services department a list. We don't want cops going out and confronting kids over and over. And so when the police commanders ask for hoops to be taken down, general services department takes them down. And that's the way it is working. So they're all being taken down at the request of the police department because the police are making runs to those sites. And let me go back to, I should have done this in the first place, to Jim Kirchner's question, whether Dr. Levy, if you have thoughts about church congregations and how they should be handled.
I think it's a tough thing. Certainly the social or personal distancing that everyone's been calling for is one of the most effective mechanisms to prevent the infections, but you want to encourage people to still worship the way they want to worship. I think the virtual, if it's possible, congregation, we're seeing this in a lot of different mechanisms, would be a good response. But I think congregating is honestly, it's a bad idea. We need people to be distanced and separated. The only way you're going to solve this problem is by keeping people who have the virus away from those who don't, and making sure the people who have the virus stay home and don't interact with others. I think that's pretty much across the board.
Any other questions? Go ahead.
Thank you, Mayor. Ed White from the Associated Press. A couple things. First, on the number of city employees roughly who would qualify for the hazard pay, how many roughly?
I probably shouldn't. Let me get you an answer to that. It's certainly over 1,000, but what the exact number is, probably closer to 2,000, but I need to get you, I probably shouldn't guess, but it'll be in that range.
Okay. You talked yesterday and today about testing nursing home residents, and there was a very tough story in the Detroit News today about conditions at Sinai. And I'm wondering how much of this effort to get into nursing homes, obviously, is to help the residents, but how much of the effort is aimed at seeing what's out there and trying to relieve the stress on some of these hospitals that appear to be very stressed?
So I've talked to Dr. Audrey Gregory about the Sinai situation, and that will be addressed with the TCF field hospital opening today with their first 50 patients. And I've said this before, while the hospitals are starting to level out on the number of people, and we don't have the ventilator crisis that they have in New York, but the hospitals are carrying 200 or 250 more people as a whole than they're comfortably carrying. And we need to offload those to the TCF Center. Lynn Terosian and the team are doing a phenomenal job over there. So you're going to start to see patients being moved from the most crowded hospitals. And what they'll do is they're going to take the patients who are getting better, patients that in a different time, if you've had somebody who's been in the hospital for a while, a lot of times they'll discharge them to a skilled nursing facility or what they call a step-down unit. They're not ready to go home, but they don't really need a doctor doctor's care all the time. The skilled nursing facilities right now don't want to bring patients in with COVID-19 into their places. And so that's one of a number of factors that has caused enormous stress on the doctors and nurses. And so the TCF Center will start offloading a lot of that stress with, I believe, 50 today and another 50 tomorrow. And I know that Lynn is expecting within a matter of a relatively short time to have 200, 250 of those beds open. That's going to be the relief for that situation, and I know Dr. Gregory is working hard on resolving it.
One more thing. I guess what triggered the emphasis on the nursing homes? Were the hospitals telling you, Mayor,
No,
we've got to get in there because they're coming in to our
No, the
emergency
nursing homes called and reported infections. They've done that for a while. And so Denise Fair's team would go out and would advise the nursing homes that you have to separate those who are contagious from those who aren't. And various nursing homes have various degrees of diligence, but by and large, the nursing homes try to do that. The problem, as I said, is you can't tell by looking at somebody that they're not infectious. And so the nursing homes were at a terrible disadvantage, as the homeless shelters have been, in not knowing for sure who was infectious and who was not. What we have now, what's changed is we have the Abbott lab test that came in a week ago today, and it will give us 15-minute turnaround time, so the nursing homes and the homeless shelters will have real-time information on who to separate. And so the reason for the emphasis is we now have the 15-minute test that we didn't have 10 days ago.
First of all, I want to thank you for all that you've been doing the last couple of weeks. And I want to thank your one doing the signing. She did an excellent explanation. I hope somebody dreamed of being a signer. I know a lot of churches have it, but your team has been excellent at responding to not only being here, but explaining to the people what they do and how they do. And that's all news people really want to know is what's happening. My question, the reason why I came to the mic, other than thanking her for her talent and hoping she inspires some young man, some young boy, some lady, some woman to do the same thing so we can speak to all of our communities. Sometimes people get stuck on their community, forget there's other communities. So I want to thank, I don't know if it was Seven or whoever it was that did the profile on her, but I want to really think it was a wonderful story for Detroit and the nation, because I went to Chicago and somebody was talking about it. My next question is, I know the governor gave you 20,000 masks. Do you know what the stockpile of your masks is for the city of Detroit?
We got 100,000 in yesterday. So Boise, Jackson, the world's most resourceful.
Oh, you ain't got to tell me. I went to Chicago to get masks, and he was on the phone. I got to shout out to Boise. I didn't want to say nobody's name, but since you brought him up, he did an excellent job at saying, Gary, if they got him on dock, because, a lot of people say they got them and they get there and they don't. Right. So when y'all ready for the next batch, I got a guy out of Chicago. We can go get the truck and get the next 100,000, 200,000. He's got them. Then the next part of that part with having them, how long are we going to do with the bus drivers? Because nobody wants to see what happened, what we saw happen. And thank you for stepping up to the plate to offer the change of the bus, and money was not an issue. And you said, okay, we're going to put them in the back, we ain't going to charge, and we also are going to, give masks.
So we just resupplied the Angelica, our director of DDOT. They're down to the last 5,000, but with 100,000 surgical masks came in yesterday, we're resupplying all the buses. So we are fine with the buses. That's when Assistant Chief White said, could our police officers take some masks with them in the car? And so now we're giving them to police officers. And I've told the other city departments, if your employees want to have masks to hand out to the public, we'll do that. So we're in good shape right now. We have 100,000 in the storeroom, and we have more on order. So the surgical masks, we're in good shape on.
And then when it comes to Cobo Hall, what is...
TCF Center.
Okay. We are all of us that's over 25.
TCF Center.
TCF.
Yeah, you really don't want to call it Cobo Hall.
I know I don't. Well, to the new hospital right now.
Right, the field hospital, okay.
They're doing, I don't know if the story's been told, but the contractors and our unions in Detroit are doing an awesome job in the city of Detroit of building showers, building restrooms, and I haven't heard anyone talk about that. I'm going to put it in the paper this week, and I just told John, whatever you want said, we're doing 160,000 copies to go door to door.
That's
Everybody
great.
will have suits on. I need to know what you want to say to the people, a letter of how we should respond. You know, generally it goes to churches, but we're going literally door to door. I got people, I went and got suits for everybody. We got masks, we got gloves. What
That's
do you want to
great.
say to the people? And what can you say to me and to the listeners right now? What is the best way from door to door to respond?
What I would say is this city has responded phenomenally. The Detroiters acted with their hearts in separating, in wearing masks. And I know it's human nature to put the video of the group playing basketball on social media and say they're not doing it, but 99% of this city responded with their hearts and have separated. And if we keep doing that, we're going to come through this sooner rather than later.
And I just want one in closing note. The shot news will be, whatever John gets to me today will be in the paper, whatever you want to say. But I definitely want to shout out to the sign lady and everybody, all the team. And, you know, your security always on the job, you know, even with the mask. So thank you so
Thank
much,
you.
Mr. Mayor, for all y'all doing.
Thank you. Any other questions?
Yes, Mayor, we do have a few more questions. We got a question on hazard pay. Reporter wants to know, do we know how many city employees that will apply to and what the total cost may be?
So we can get you those numbers. Dave Masseron has them, and rather than me guess, but what we have done is balance those expenses against the budget cuts that come next week, and we believe we can manage both and get to a balanced budget. It won't be easy, and they'll be paying, but we see how to get there.
Okay, and this question could be for Dr. Levy. The reporters wanted to get a little bit more clarity on the partnership with going to the state fairgrounds, what exactly you're going to be providing and how that'll work.
Great, thank you. So the partnership really is one with Wayne State University Physician Group, and Access in Dearborn. And we have been running sites 5 days a week at 400 Mac in Detroit and at Access headquarters in Dearborn. And we've been focused on symptomatic first responders and healthcare workers. What we're doing now is we're going to close those sites down and merge in with the state fairgrounds. And what UPG is going to be doing is providing assistance with the prescriptions for individuals who need them to get their testing, and also staffing a couple of the tents over there to facilitate the throughput. So we're going to be helping on the front end and on the throughput process, and also on the back end, making sure we close the loop and everybody who gets a prescription from us will get the report delivered directly to them on the results.
Okay. And last question from the Detroit News is, the president said at his afternoon briefing that Detroit and New Orleans were seeing COVID cases go up, but now it looks like they're stabilizing, and believes that Michigan and Louisiana are doing much better than we thought. And I wanted to get your thoughts on that, Mr. Mayor, in terms of whether you agree with that, or if you have any.
Again, I'm just going to keep telling people the truth on the data. And 3 weeks ago, when Michigan was down, I said the data looked to me like we were going to pass California and Washington and be the third highest rate in the country. That's what the data showed. It was bad news, but that's what I believed. Now, I'm going to continue to say this. We're bending the curve. There is no doubt the people in this city and the mask and the separation are doing it, but it's still going up and it's still dangerous. And so if what the president is saying by that is that we're bending the curve, that's true. But it is still a very dangerous time for Detroiters, and I am really glad it's now understood. If you get infected with COVID-19 and you're African American, you have a 2 to 3 times greater chance of dying from it than a Caucasian. It is really critical in this community that we keep doing what we're doing. So we're seeing progress, but we're not letting up.
Okay, and that was the last question.
All right, thank you.